These next few things are sometimes syndromes and sometimes association. This is Beckwith-Wiedemann syndrome. Again, with Beckwith-Wiedemann, it's going to be chromosome 11. You're going to find a lot of different chromosomes, and they might ask you which chromosome is it on. They might describe the patient, so you'll have to make the diagnosis by the description. They might ask you what chromosome, or they might ask you what are complications, what other findings will be seen with this patient. So keep those in mind. One of the important things you need to remember about Beckwith-Wiedemann is that they have hyperinsulinemia. These tend to be very large babies. So macrosomia is seen at birth, and since they have hyperinsulinemia, that is a growth hormone that makes them big, but at the same time, they're at risk for hypoglycemia, particularly at birth. These babies will also have a very large tongue, sometimes severe enough that it can cause airway problems, and it can actually cause feeding problems. Sometimes, as they grow older, the face grows around the tongue better and it doesn't become a problem, but sometimes these tongues need to have resections, wedge resections, so that they don't have feeding problems. As I mentioned, neonatal period, look for hypoglycemia, and these babies may have omphalocele. These babies are also at risk for tumors in the abdomen. So they will need, as part of their follow-up, they need ultrasounds every 6 months, screening ultrasounds every 6 months, usually till about 6 years of age, after which, if you don't see any tumors like hepatoblastomas, then they're probably safe and you don't have to worry about them developing any tumors after that. Here is a patient with Beckwith-Wiedemann. You can see that's a very large tongue. It can actually obstruct the airway and certainly can cause feeding problems in these patients.